Hello, my name is Jake Begun, and I'm a gastroenterologist at the Mater Hospital in Brisbane, Australia. I'm also the outgoing chair of the Gastroenterological Network of Intestinal Ultrasound, based here in Australia. And over the past 2 years as chair, we've really taken to heart training in ultrasound in Australia. And we were very proud to host our second Module 1 course in Australia. The first was 2 years ago in Melbourne, and this one was held virtually, of course, due to the circumstances that we find ourselves in. The course was originally meant to happen at the Gold Coast, which is a fabulous location here in Australia, and where there's an ultrasound training center. But because of the COVID-19 pandemic, like other courses around the world, we had to make ours a virtual course, which had its own challenges associated with it. Fortunately, the folks at Portugal had helped develop their first course that was done virtually, and that really made it a lot easier for us to emulate that, but also give it an Australian flair. We had a great response to the course in terms of people signing up, and we had over 35 trainees who came to the Module 1 for both days of the course. This was an interactive session with breakout rooms as well as recorded didactics, and the feedback that we've been getting so far from the trainees who attended has been really positive. The interest is growing in intestinal ultrasound around the world, and especially here in Australia, and we're really trying to integrate it into the training program of gastroenterology here so that it becomes natural and second nature for gastroenterologists to use intestinal ultrasound for the assessment of inflammatory bowel disease. And I think I see that mirrored in other parts of the world as well. For someone who is interested in intestinal ultrasound, who wants to become certified, then there's a very straightforward procedure through the IBUS organization. That starts with Module 1, which is an introductory course that includes a didactic and hands-on component, which really familiarizes participants with the function of intestinal ultrasound, the way to set up the machines, and some of the pathology that you can see with intestinal ultrasound. That's followed up by Module 2, which is a one-on-one experience with an experienced ultrasonographer at one of the IBUS training sessions, where you have to do at least 40 scans independently with your supervisor watching. And then following that is Module 3, which is a final wrap-up course that's usually done each year at ECHO with an exit examination. And then after that, your logbooks are reviewed, and then you're signed off as certified by IBUS for intestinal ultrasound. Here in Australia, we're embracing the IBUS modularity in terms of their training, but also doing more hands-on training for our Australian trainees who don't have a lot of ultrasound experience prior to their Module 1 course. We're very excited for the future of intestinal ultrasound in gastroenterology and in the care of inflammatory bowel disease, because we're convinced that it will lead to the best outcomes for our patients and improve all of our practice patterns in this important disease. Thanks very much.